Hello, I'm Dr. Seth Meyers, Assistant Director at Student Health Services. In a moment, our physician, Dr. Walker, is going to share some important information with you about the vaccines and how they can protect against COVID-19. But first, I want to take some time and acknowledge what the return to campus may be like for us emotionally. You know, the past year was historic in the challenges that it brought. And many of us, as we return to campus, may find ourselves feeling a mix of feelings. Some may feel anxious or nervous about returning. Some may feel sad or disappointed, having gotten used to particular routines in the past year. But what's important is that for every member of our college community, the transition to return to campus will be smoother if we focus on the positives. If we focus on some of the life lessons that we learned in the past year, if we focus on the renewed energy that we have as we return to campus, and if we look forward to feeling connected again to each other in person. So let's make an extra effort to support each other through this transition. Let's make an extra effort to stay positive and hopeful. Let's practice good coping skills that include regular, healthy sleep patterns, that include regular and healthy eating patterns as well. If you have any moments where you feel nervous energy or anxious, take a moment and exercise. Exercise out that energy or take on a personal or a work-related organizing project which will make you feel more focused and more internally organized. Ultimately, our hope is that we as a community return to campus stronger and more cohesive because we are going through this transition together. So I hope these words have been helpful, and next we'll hear from Dr. Walker.
Hello, I'm Dr. Ann Walker. I work in Student Health Services at Mt SAC, and I want to talk about what we know about the safety and efficacy of the Pfizer, Moderna, and J&J COVID vaccines. These are the 3 vaccines with emergency use authorization in the U.S. The CDC endorses all 3 vaccines with no preference. Their advice is to take the first vaccine you're offered for which you have no contraindication. All 3 are considered to be highly effective. We know that the neutralizing antibodies from the Pfizer and Moderna vaccines show some diminished effectiveness against some of the newer variants. The expectation is that they will still be effective because the success of the immune response is based on more than neutralizing antibodies alone. Both Pfizer and Moderna are investigating multiple approaches to boost their efficacy for new variants if their performance is compromised enough to need a boost. The J&J 2-dose phase 3 trial is likely to have results by this summer, with an overall efficacy expected to be even closer to the results of the Pfizer and Moderna vaccines for the older COVID strains. There's reason to believe that it will also have a higher overall efficacy against the newer strains that resulted in the lower efficacy for the J&J 1-dose South Africa and South America trials. These vaccines have very few ingredients. The active ingredients are messenger RNA in the Pfizer and Moderna vaccines and a non-replicating adenovirus viral vector that delivers DNA in the J&J vaccine. The mRNA and DNA direct the production of spike proteins to teach your immune system what to destroy. Polyethylene glycol is a component in the Pfizer and Moderna vaccines. Polysorbate is a component in the J&J vaccine. The rest of the ingredients are cholesterols, sugars, salts, and buffers, which are not expected to create any allergic problems. There are no eggs, no gelatin, no latex, and no preservatives. Understanding the few people who should avoid these vaccines requires knowing about immediate allergic reactions. These are reactions that happen within 4 hours of exposure and more typically much sooner. Immediate allergic reactions vary from mild to life-threatening. The symptoms can include itchy hives, painful swelling or redness of the skin, and wheezing. Anaphylaxis is the most serious immediate reaction and usually includes any of the first 3 symptoms plus lip, tongue, or throat swelling and requires immediate medical attention. There are very few people who cannot take these vaccines. If you have had anaphylaxis or any other immediate allergic reaction with a dose of COVID vaccine, nobody will give you another dose of the same vaccine. If you've had anaphylaxis or any other immediate allergic reaction known to be due to a component of a COVID vaccine, no one will give you a COVID vaccine with the same component. All 3 of these vaccines have very few components. Reactions to polyethylene glycol and polysorbate are rare, but they can happen. Polyethylene glycol is used in a multitude of everyday products such as toothpaste, shampoos, laxatives, cosmetics, and baby wipes. Polysorbate is widely used in over-the-counter and prescription medicines and in food preparations as an emulsifier. If you have never had an immediate allergic reaction, it is highly unlikely you will have that kind of reaction to the polyethylene glycol and polysorbate in these vaccines because most likely you've been exposed to both of those compounds countless times in the past. There are only 2 precautions for these COVID vaccines. If you have a history of an immediate allergic reaction to any other vaccine or injectable therapy that doesn't already qualify as a contraindication for a COVID vaccine, you should weigh the risks and benefits of the vaccine. You should consider evaluation with an allergist immunologist, and you'll need to be observed for 30 minutes. If you're being switched between classes of COVID vaccine based on a contraindication to the previous COVID vaccine, you need the longer observation, and you may also need to consult an allergist immunologist. For complicated cases, the CDC has a network of vaccine safety experts to help make decisions. You will need a physician to refer you to the Clinical Immunization Safety Assessment COVID-Vax project. All other medical issues get the green light to vaccinate. Immediate allergic reactions, including anaphylaxis for oral medications, foods, bee stings, latex, and other triggers, are not a problem. If your reaction was anaphylaxis, you will get watched for 30 minutes instead of the usual 15. There is a long list of underlying medical conditions that also get the green light. While a person who is immunocompromised may not respond to the vaccine as strongly, the vaccine is safe for them to take. A prior history of autoimmune disease, Guillain-Barré, or Bell's palsy are no barrier. There are no reasons to believe that there are safety concerns with pregnancy and breastfeeding. Studies in pregnancy and breastfeeding are being done. It's common to have side effects with the COVID vaccines. Those side effects usually start in the first 3 days and resolve spontaneously in 1 to 3 days. They are usually mild to moderate. The local side effects are the common pain, swelling, and redness at the injection site. The common systemic side effects are fever, chills, headache, fatigue, muscle or joint pain, and occasionally vomiting and diarrhea. Remember, these systemic side effects are identical to COVID. If you have them, and especially if they seem to hang on, talk with your medical provider about whether you need COVID testing. The vaccine won't interfere with the testing. If you also have cough, shortness of breath, loss of taste or smell, or congestion, these are not considered typical post-vaccine symptoms. If you have any of these symptoms, you must ask about COVID testing. There are a lot of common questions about the COVID vaccines, and many of them revolve around safety. The Pfizer, Moderna, and J&J vaccine work by supplying the genetic code for the virus spike protein. Some people wonder if these vaccines can alter their DNA. The short answer is no. The Pfizer and Moderna vaccines use messenger RNA, and the J&J vaccine uses DNA to produce spike proteins to educate your immune system. The messenger RNA has no tools to get it into the nucleus with your DNA, no reverse transcriptase to turn it into DNA, and no integrase to combine it with your DNA. The spike protein DNA of the J&J vaccine is delivered into the nucleus by the adenovirus vector. It doesn't have integrase to allow it to combine with your DNA. Once in the nucleus, it is converted to messenger RNA and sent out of the nucleus to direct the production of spike proteins. Many people wonder if there could be problems that don't show up until later. Historically, you tend to see adverse effects of vaccines within 6 to 8 weeks, especially once they are in wide use. Safety data has been collected for these vaccines since clinical trials started last spring. Currently, the J&J vaccine is on pause to evaluate 6 cases of an uncommon clotting problem. With millions of people being vaccinated every day, some of these clots will occur in those receiving the shots just by coincidence. Pausing allows time to investigate whether the clotting is due to the vaccine. If it is felt to be due to the vaccine, the pause allows time to give advice about the symptoms to watch for, which persons are most at risk, how to treat the problem, and to make decisions about whether to limit the use of the vaccine. At the same time, we're already aware of the bad effects of COVID. We know that as many as 5 to 20% of hospitalized patients will die due to COVID. As many as 30% of COVID patients in the ICU develop clotting problems. Of hospitalized patients who do not die, we are seeing as many as 70 to 80% of them with ongoing COVID symptoms 6 and more months later. We are also seeing long-haul COVID symptoms in persons who were never ill enough to need hospitalization. Some people may wonder if a COVID vaccine can create a false positive COVID test result. None of these vaccines will interfere with the PCR and antigen tests used to diagnose COVID illness. We do expect all of these vaccines to produce antibodies, which should be picked up by most spike protein antibody tests, but antibody tests are not a way to diagnose COVID illness. We have no reason or evidence to suspect that COVID vaccine can interfere with fertility or pregnancy. The initial clinical trials did not include pregnant persons, but there were no safety issues seen in the pregnancies that occurred during the trials. There are trials underway to provide more data regarding pregnancy and lactation. Some people have been concerned that there is a spike protein involved in the growth and development of the placenta in pregnancy, but it is completely different from the spike protein of the virus. It would not be targeted by the vaccine antibodies. Being ill with COVID can have a serious impact on the health of the pregnant person. Many people raise questions about the speed with which these vaccines were developed. There are lots of factors that help explain how we've gotten to the point of having effective vaccines so much more quickly than in the past. It's important to know that all of the usual steps in developing and testing the vaccines have happened. Reducing the financial risk of the companies developing these vaccines made it possible to use an overlapping schedule, which allowed faster data collection. The Pfizer and Moderna vaccines are the first mRNA vaccines approved for human use, but this technology has been in development for decades. Once you know the genetic code for the protein you want the immune system to recognize, building the mRNA or DNA for that protein is much faster than some of the older technologies for creating the active ingredients of other vaccines. The health, financial, and social impacts of COVID on the lives of people around the world along with the high frequency of the disease, has made enrolling people in trials faster than ever and has vastly reduced the time needed to reach statistically significant endpoints in the trials. If you have not already been vaccinated, I hope you're feeling ready and confident about getting one of these COVID vaccines. If you still have questions, I recommend that you talk to a trusted medical provider and look at the information on the CDC website. If you enter "Key Things to Know About COVID" in the search bar on the home page, the first link will take you to a broad sheet of information with links to other information on the left margin. Thank you for your time.